Welcome to another episode of the MSD Manual's Medical Myths podcast. On this show, we set the record straight on today's most talked about medical topics and questions. Listeria and foodborne illness have been prominent topics in the news lately, but what exactly are they and where do these risks come from? In this episode, we will define what a foodborne illness is, take a closer look at Listeria and listeriosis, and share best practices for keeping you and your family safe. I'm your host, Joe McIntyre. Our guest today is Dr. Larry M. Bush, an infectious disease specialist. Dr. Bush is an affiliate professor of medicine at Charles E. Schmidt College of Medicine at Florida Atlantic University and an affiliate associate professor of medicine at the University of Miami Miller School of Medicine. Dr. Bush, thank you for joining us.
Thank you. Thank you for having me. It's my pleasure.
Well, let's first start off with educating our listeners a little bit about foodborne illness generally. Can you explain what that is?
Sure. So a foodborne illness or a disease results from the ingestion of a wide variety of foods that have either been contaminated by a pathogenic microorganism, most commonly a bacteria, but it can be a parasite or a virus, or by a microbial toxin, a toxin that organism produces, either prior to eating it or after you've eaten it, and even by chemicals. For instance, heavy metal poisoning can be contaminated in food, as well as mushroom poisoning.
Now, what is the difference between a foodborne illness and a stomach bug? Are they the same thing?
Well, a stomach bug is sort of is a lay term. A stomach bug, in essence, when you really think about it, the only organism that we really know that infects the stomach is Helicobacter pylori, H. pylori, which is commonly seen with people who have ulcer disease and occasionally can cause a cancer in the stomach. So it's really not the stomach that gets infected, but it's the small intestine, and we call that enteritis, or the large intestine, and we call that colitis. Often when people say I have a stomach bug, what they're referring to is a brief diarrhea disease, most commonly secondary to some of the viruses that we come encounter with all the time.
Now, what are the most common sources of foodborne illness in the United States? I think we see a lot in the media when it comes to lettuces or potentially meats, but what are some of the most common sources that you come across?
Well, it depends on the organism, but the majority of them either come from beef or pork or poultry, fish, particularly shellfish, contaminated water. Some of these things come from sprouts or melons or plants that we eat. So there's a whole range, but I think most people think of them with contaminated beef or pork, poultry, shellfish, other types of fish, delicatessen meats. We know, for instance, Listeria, a particular organism associated with cheeses, and unpasteurized milk.
Are there specific foods or handling practices that people often overlook, which could pose or create some risks for foodborne illness?
I think the major thing is undercooking and thinking things that can stay good in the refrigerator for a longer period of time than they're really meant to be, as well as keeping things outside of the refrigerator. For instance, it's probably a common practice that people defrost their food outside of the refrigerator, and within a few hours, the surface becomes defrosted, and even though the center may still be icy, the surface can have organisms contaminated. Other ones are not washing off your things, your plants, your vegetables, other materials that you eat, and the utensils and the devices that you're using to cut or store these things, putting them next to each other in the refrigerator. One common thing that seems to go unnoticed is, for instance, raw chicken. People tend to wash raw chicken off in the sink before they use it, and they can contaminate other things that are in the sink or other food products that are nearby. And it's recommended if you're going to fry, for instance, chicken breast, it goes directly into the pan and should not be washed off.
Does cooking food thoroughly kill all types of harmful bacteria? And I guess another question is, what does cooking thoroughly even mean? You mentioned it, cooking cooking these meats well, but what does that really mean?
Well, actually, the CDC publishes documented data on how much the temperature has to get to for certain types of meat. For instance, for beef, veal, goat, and lamb, the recommendation is 145 degrees. And the only way you would know that is not by the temperature we set on our ovens, but by using a thermometer. And I know most people probably do not do that. For chicken and turkey, it's recommended that these be 165 degrees. I know with Thanksgiving coming up, often people will use a thermometer putting it into the turkey, but 165 degrees is recommended. For eggs, it's also 160 degrees or cook it until the yolk and whites are firm. Ham happened to have a lower temperature of 145. And for leftovers, they should be reheated to 165 degrees. So it's variable depending on what type of food you're using. And again, it's really based on using a thermometer and not going by the temperature that's on the oven that we use, because it's the inside of the product we're cooking that really counts, the temperature measurement, and not the outside.
What is the reason, Dr. Bush, that certain meats have different temperatures that means they've been deemed safe to eat or cooked thoroughly? Why is poultry different from beef, different from pork, things like that?
One is the type of organism that they're more associated with and what they're sensitive to as far as temperature. And two is the depth or the consistency of the meat that's being cooked and how compact it is, and is it really reaching enough of the organisms.
You also mentioned the safe temperature to cook eggs, and I'm sure some of us, myself included, have had a few cocktails with potentially raw eggs in it or egg whites in them. Is that safe? Is there a significant danger to drinking those types of cocktails or consuming eggs that have not been fully set, either the whites or the yolks?
Yes, although it's uncommon, those may be contaminated with certain bacteria that are prone to be found in poultry or chickens. So, although when you think about the vast majority of people who contract a foodborne illness, either asymptomatic, that never get diagnosed, or they were fortunate in the food stuff that they're eating just does not carry the bacteria or a sufficient quantity of the bacteria. For many of these organisms, it's not just that the bacteria is present, it's the quantity that has to be present to produce an illness that's symptomatic. I'm not sure I said this at the beginning, but it's felt that there are about 48 million cases of foodborne disease in the United States every year. And that's hard to know because, as you would expect, most people don't go and get examined or tested, and therefore it's not reported. It's a transient gastrointestinal symptomatic disease. But out of those 48 million, about 125,000 get hospitalized, and is about 3,000 deaths related to foodborne illnesses every year in this country.
Serious stuff. I mean, when you say that many cases, and often people don't know, is food poisoning always noticeable immediately after eating contaminated food? Basically, does it require a stomach ache or diarrhea or some other symptom for you to know that you have food poisoning, or can you have it and not even know it?
Most people probably have it and don't even know it, and they may have some indigestion or a very transient nauseous episode or slight diarrhea that's short-lived. It also depends on which organism you ingest. As I said, the ones that form toxin outside the body, and what you're actually eating is the toxin that's been placed in the food where the organism is living. For instance, that's very typical of Staphylococcus. It produces a couple types of toxin. One of them may be produced in the mayonnaise or the salad that you're eating, and the toxin's present. In those particular instances, the person gets ill rather quickly, and the illness is a transient nauseousness, vomiting that may come on even 6 hours after and goes away within 12 hours. That's the same thing we hear about reheated rice, where an organism called Bacillus cereus can live. And that also can produce a toxin outside of the body and produce a quick onset of nauseousness and vomiting. Other organisms have to percolate, so to speak, in our intestine. They invade the intestine, they inflame the intestine, and that could take 1, 2, 3 days. And then they'll present with more systemic illnesses like fever, abdominal pain, severe diarrhea. And then we talked about listeria at one point. I know we'll talk about that some more. Listeria can leave the intestine and invade other organs that may not become evident until days and weeks later. That's why listeria is such a severe concern in pregnant women, because they may be asymptomatic for quite some time, but it does damage to the child. They can be born with listeria, and it's a common cause of premature labor and stillbirths.
Interesting. How do you, especially if the mother doesn't know, and it could be a potentially, weeks or until birth that a mother might know. What can you do to avoid it? Is it simply following, the guidelines for eating? Is there other ways to notify or to educate yourself about whether you have listeria or not?
There are strict guidelines that I'm not sure if many obstetricians actually discuss or present to their pregnant patients about foods to avoid. And what you're really looking for are diseases that would be more severe in pregnant women. Pregnancy is an immunologic deficient state. And the reason for that is because the woman is carrying another being, almost like a transplant, and you don't want your immune system to attack it. So when we think of some of these diseases, they're more severe in people at the extremes of age, very young or very old, because both extremes have either underdeveloped immune systems or immune systems that have waned. They're severe in people who or take medications that are known to lower their immune system. We see a lot of these advertised on TV for diseases like psoriasis, Crohn's disease, inflammatory bowel disease, rheumatoid arthritis. Obviously, people who are receiving medications because of transplants, or even people with diseases that are common day now, such as HIV or AIDS. And those particular persons had to be very cognizant of what they're eating. For the normal person, eating a Listeria bacteria may cause no symptoms. A pregnant woman has a 17 to 27 times higher risk of having a severe disease. And the interesting thing about Listeria is since the symptoms may come on so many days after exposure, it's very hard to do contact tracing to figure out, well, who was around the same type of food at the same time because they present at different times.
Uh, is this why pregnant women are often it's recommended to avoid lunch meats and sandwiches that have deli meats in them?
Absolutely, and soft cheeses, certain fruits, certain melons, certain types of shellfish, and other type of fish. Uh, People think pregnant women may think that keeping the food in the refrigerator keeps it well, but Listeria likes to grow in cooler temperatures. So there's a whole list of foods that pregnant women are particularly warned against. I'm not sure how common that's provided to them, how commonly that's provided to them by their obstetrician, but certainly they could ask, what should I avoid in my diet?
Important to know. We often hear about the sniff test, where if you smell something and it doesn't seem right, that means it probably isn't. But even if a food maybe passes the sniff test, can food that looks and smells fine still be contaminated?
Well, unless the sniff test has something to do with the odor of the food that's normally there, for instance, onions or something of that nature. Yes, because when you think of it, when we think of why somebody has bad breath or why their bowel movements may have a particular odor, or sometimes people complain of odor in their urine, it's really the byproducts of bacteria or the bacteria themselves dying that produces the odor. That's what gives us bad breath. So if you have a quote sniff test and the food smells like it should not, the assumption would be that there is bacteria. It's heavily laden with bacteria that are producing byproducts or that are dying, and that dying and byproduct production produces that odor. I would certainly avoid them, not only dispose of them, but clean the surface that they were on. And if you stored them in the refrigerator, you need to make sure that you clean everything in that refrigerator. And if you have food that's been sitting up against them, that should be discarded also. It's important that when you put food such as poultry and beef and pork in a refrigerator, you separate it if it's open and not in the container from many of your other foods.
You mentioned a few issues where you wish more doctors spoke to their patients about potential issues, especially for pregnant women. As a infectious disease specialist, are there any other tips that you would recommend that we haven't talked about so far for people to avoid eating certain foods based on their population, their gender, their whether they're pregnant or not? Are there any other recommendations that you have that we haven't talked about so far?
Well, the immunocompromised people that we talked about, and a lot of people think, well, my immune system's fine. But if you're taking even a high dose of prednisone, a common corticosteroid medication, for various reasons, once you've been on it for several weeks, and we're only talking around 3 weeks, your immune system does become defective to some degree. And we don't necessarily measure that to say, well, how much is my immune system down? So I would recommend all those people be careful with some of these foods. Undercooked food, food that's being lying out, foods that are known to carry certain bacteria that you would not know because of the taste, deli meat, shellfish, etc. I don't know if you've ever noticed or your listeners have noticed that if you go into seafood restaurants, it's very common, and in any restaurant, when you get to the seafood section, it tells you that if you have underlying immunosuppressive disorders or you have liver disease, you should really avoid shellfish because shellfish can carry something called Vibrio vulnificans, And people who have underlying liver disease for whatever reason may have a real severe complicated infection, not just gastrointestinal, but infections that would cause what we call a necrotizing fasciitis, which destroys the soft tissues on your arms and your legs. So those types of folks clearly have to be aware of what their immune system may or may not tolerate. And even though we like to, delve into eating certain foods, I would clearly avoid them.
Final question here, Dr. Bush. Are there any other myths that you find yourself busting or coming across, whether it's friends or colleagues or potential patients or those students you come across asking you these questions that you often find yourself busting more often than not?
I'll tell you one myth that's very interesting. People think if they eat in a so-called five-star restaurant, the chance of getting ill from the food is very small. Well, all foods are checked by the FDA and they go under their practices. But five-star restaurants, if you walk into the kitchen of a five-star restaurant, as opposed to, let's say, a fast food restaurant like Wendy's or McDonald's or Burger King, the people preparing the food in a five-star restaurant, and you may notice this on these chef shows on TV, they don't wear gloves. So if they happen to be transmitting any organism in their asymptomatically in their stool, it's likely to get on our food. So the highest rate of food illnesses, if they're related to a restaurant, usually are in high-end restaurants, so to speak.
Okay, Dr. Bush, as we wrap it up here, I know we talked about a handful of foodborne illnesses. Can you tell us what is the most common? What is the most common that you come across? What is the one that you see most often here in the U.S.?
So I don't come across it that much, and partly because it's self-limited for most of the time, and people tend to get better after an acute illness, which would either be nauseousness, cramping, or diarrhea. They don't get very ill. It doesn't spread to other parts of the body, so therefore you don't get somebody with a gastrointestinal foodborne disease and now winds up with a brain or a spinal fluid infection. Like that could happen with Listeria. The other thing is it's very contagious, and the answer is norovirus. Norovirus is the number one foodborne illness in the United States, and we always associate it with cruise ships. And the reason for that is because it's so contagious and people are so contained and going to the same dining room over and over and over that a lot of people get ill. Norovirus is transmitted in seafood, is transmitted in salads. Therefore, you got to really wash off your lettuce when you're preparing your salad, etc. But that is the most common illness, foodborne, in the United States that people don't give much thought to because they say, well, I haven't been on a cruise. You don't have to be on a cruise. The difference on a cruise is it's very close contact with the other people on the ship with you.
Are there any tips that you have to avoid it other than maybe not going on a cruise?
No, it's to, well, one, they're preparing the food, so you don't have a lot of choice in who's preparing the food. But two is to carry hand sanitizer with you and use it, not sparingly, but use it quite a bit everywhere you go, because it will eliminate the norovirus on your hand before you get it into your mouth.
Thank you so much for joining us on this episode of the MSD Manual's Medical Myths podcast. I will let you leave our listeners here with the final word.
Please keep in mind, medical knowledge is power. Please pass it on to your friends and family.